The system is really just the capsules. I don't have to have my patients wear an expensive box on their belt. Not only that, but really, unless you have multiple boxes, you can only do one study at a time. Whereas with CapsoCam, I just give them the capsule, they swallow it, and it gets sent off and uploaded to the cloud where I can access it. That made it rather convenient for me. It took away a lot of the barriers that are present with some of the competing technologies. I'm a solo practitioner. That means I have to be very conscious about money. It's all coming out of my pocket, not out of someone else's. The other systems that I looked at earlier had a prohibitive entry price, and for something that I did not think I'd be using all that often, there was no way I would ever recover my investment. That was really the barrier for getting into capsule endoscopy earlier. But with CapsoCam, it made economic sense for me to start using something that could benefit my patients and wouldn't push me into bankruptcy at the same time. Learning process involved in the capsules. And it's a bit intimidating at first. I didn't really feel like I was an expert at reading small intestinal pathology. But actually pretty quickly I could identify when things weren't normal. Frequently I could identify what the problem was, and sometimes I had to go to reference material to really find out what I was looking at. Sometimes it meant referring the patient out to a place that would do, could actually have biopsies and could do small intestinal endoscopy. But I quickly learned that even though I didn't feel like an expert, I was probably doing about as good a job as the so-called experts at identifying when something was wrong.